Now, you're known for sedation dentistry. What's that like? Like, what kind of procedures are you doing sedation, and how safe is it?
Yeah, so we have patients who don't like to get their teeth cleaned, and they'll have sedation to get their teeth cleaned. Our typical sedation patient is someone who hasn't been to the dentist for 10 years, and they probably had a bad experience as a child, and they've neglected their teeth, and they know it. But picking up that phone requires every ounce of courage that they have to even make that initial phone call. They come in with tears. I've had patients physically ill coming into the reception room. They just can't get over that hurdle. But they usually have a loved one encouraging them. Oftentimes they'll accompany them to the office. And we have a big box of tissue placed strategically because we know the tears are coming. And what I tell these patients is that we are a very empathetic, caring bunch of people who are going to make a big difference for them. And you think in healthcare, people, they're sedated for even the most minor of medical procedures. And yet in dentistry, we expect people to be awake for all these things. So sedation has opened up an avenue for people who have been afraid to go to the dentist their whole life. So with sedation, a patient can come in and in a very short amount of time get a lot of work done, usually in one visit. So imagine you've been afraid your whole life to go to the dentist. You've got a tooth that's been bothering you, or a couple chipped teeth, maybe you don't like your smile, and all of a sudden you can come in one visit get all of that treated and corrected. Get the infection removed so you're comfortable again, and get your smile back.
When you say things like you could do 6 months worth of dentistry in one visit, what does that mean with sedation? What does that mean?
So typically patients can find 45 minutes to come in and get a crown done or get a filling repaired. So we'll have a patient come in for maybe 3 hours, send them off to La La Land, and get everything taken care of in one visit. The sedation has very strong amnesic properties too. So I'll have patients, when I follow up with a phone call that evening, they'll say, Jeff, I don't think you got everything done, because I don't ever remember you doing anything. And that's the beauty of it. So we're able to get a very long list of things taken care of and get them back to a state of health.
So for the busy person, because obviously you have the phobics, but the person with 3 kids, or they're running a large business, they don't have time to go back and forth. So this is like a way to get it all done.
Imagine the time you're wasting in your car going up and back to the dentist for 3 visits. People just don't have time. There's busy moms, there's busy dads who have a long list of responsibilities. So they're able to take an afternoon off of work, come in, get everything taken care of in one visit.
So what do you like the best? I guess you could give them a pill, you could give them that mask, the nitrous, or IV sedation.
So the safest way to have someone sedated is with IV sedation, because we can give them the exact amount of drug that's required to send them into a happy place. So we don't.
Can you pull them out of it also because it's sedated?
You can reverse it in 30 seconds.
Unlike the pill.
Yep.
Okay.
Yeah, extremely safe. I tell you, it's opened up a way for people who haven't been able to get to the dentist in their whole life. They've feared this. Every time they break a tooth, they're like, oh my gosh, I'm going to have to go to the dentist. I can't do it. I can't pick up the phone. And these are some of the happiest patients that I have in my patient base, Randy, because they come back and they're like, Doc, thank you you've changed my life. I'm able to get on with my life now without a toothache, without sensitivity. I've got a new smile, whatever the case may be.
Is it true that less than 5% of all general dentists even have this IV sedation certification?
I think that's the case. It's more of a trend. More and more people are doing it, but it's definitely a niche.
Yeah. And you've been doing it a long time. Yeah, from day one,
15 years we've been doing IV sedation.
And you couldn't do it any other way?
I can't imagine doing it any other. The only thing I miss is cracking jokes, with my patients. Because when they're in La La Land, I can't really crack a joke with them. And my assistants have heard all my jokes already. But it's a fantastic way to get the dentistry that you need and the dentistry that you want without having to be an active participant.
And then they probably actually like coming to the dentist.
Yeah,
that's true?
I tell them that's my goal. I don't expect you to be excited to come see me for a follow-up check, but I want to make it so that you don't dread it, so that you think, oh, hey, I'm going to go see Jeff today. I'm going to go get my teeth cleaned. I'm going to go get whatever the case may be. And once we accomplish that, then we really know we hit the home run. And we do that every day.